hope you're all feeling well out there because health officials right now are warning of a second surge of flu activity following the holiday season.
Respiratory virus levels are climbing across the U.S. after weeks of decline. The CDC reports nearly 16.2% of clinical lab samples tested positive for the flu for the week ending in January 27th. Well, that's nearly a 2% uptick from just the week prior. CDC officials say at least 20 million people have gotten the flu since October. So for more on all this, we're going to bring in Dr. William Schaffner. He is a professor of infectious diseases at Vanderbilt University Medical Center and also does such a great job of keeping all of us healthy. So, Dr. Schaffner, talk to us first of all about why the flu cases are on the rise again now.
Well, Lana, it's that time of the year, right? We're in February. We're not beyond the winter yet. It's still respiratory virus season. And recall, these respiratory viruses like to plague us through February into March, and then that's when they really begin to recede. So we've got another month of flu, some COVID, obviously, RSV. That virus is coming down. So our emergency rooms, stat clinics, doctors' offices, and the like are still full of patients sneezing, coughing, feeling poorly because of flu and these other viruses.
I kid you not, Dr. Schaffner, I haven't been able to get a haircut in about a week and a half
He's been complaining about it.
My barber has been ill. I think he's on the mend, so a haircut's coming up soon.
We're on barber watch.
Yeah, so I know that this is happening to a lot of people, and health experts have historically had challenges in predicting how long flu seasons would last or how severe it would get. I'm just wondering, based on the data you're seeing now, what's your expectation?
Well, expectations are hazardous when it comes to these viruses, but sincerely, I think we will have flu through most of February, and then when we get to March, it will begin to recede. And by mid-March, it ought to be essentially gone. So my fingers are crossed. We will have had a moderately severe influenza season. Not enough people really took the vaccine, and I would hope that people have a belated New Year's resolution to this fall, when we get into September and October, to get that flu vaccine, because it does help keep you out of the hospital. It can't prevent every milder case, but it helps keep you out of the hospital. Nobody wants to go to the hospital with influenza.
No, and that's particularly important for vulnerable populations. But let's say, Dr. Schaffner, you have done what you're supposed to do. You got your flu shot. Is there anything else that you recommend people do to keep themselves safe?
Oh, you bet. This is especially true of people who are older, people who have underlying chronic medical conditions, if you're a pregnant person or if you're immune compromised. Get out that mask. If you're going indoors to a crowded environment, religious services, concerts, basketball games, anything like that, put that mask back on, even to the supermarket. Number two, should you become ill, please go ahead and contact your healthcare provider immediately. We'll likely do some testing. We have medicines against flu and against COVID that will help keep you out of the hospital. Try to avoid people who are coughing and sneezing, and beyond anything else, if you do have symptoms, please don't go to work, don't go to school, don't be a dreaded spreader.
Stay at home and watch us here on the Midday.
Don't cut anybody's hair either.
All right, Dr. William Schaffner, thank you for all that you do.
Thanks, Doc.
My pleasure.